So, hello everybody and welcome to this month's team brief. We're going to take a little time to get a bit of an overview of how things are going in the hospital in relation to our performance. We're under some pressure, so Bob is going to talk to us about how that's going. Then we're going to take a look at the financial position. We've talked a lot about the challenge that we're experiencing this year, so Simon will give us an update and talk about what more we need to be doing. And Heather is going to take a brief look at the really difficult challenge we've got around staffing at the moment, which I feel is probably our most critical limiting factor. So she's going to talk about what the position is and what we might do to improve the situation. And then we're going to have a really more detailed conversation and look at our approach to quality improvement in the organisation, which will be the way by which we go about creating that culture of curiosity and creativity that I've been talking about in order to improve patient care. So, over to the team.
I want to talk about a couple of things today, which I've been sharing with Team Brief. Firstly, the work we're doing both inside the hospital and particularly with our system partners, that's adult social care, our commissioners, primary care or GPs, and urgent care, who are our local community provider, to improve how patients flow through our hospital and out to onward settings of care in the most appropriate and safe way, in order to improve flow in the hospital and to make sure that we can look after everyone in the most appropriate place. And that work has been going for a few weeks now, but has just sort of increased in its scale and effect this week, and in finding an increased ability for patients who traditionally had been waiting in the hospital to actually leave hospital and go to the right next setting of care, or indeed back to home. And that's starting to help us free up capacity and flow inside the hospital, particularly from our emergency department into the rest of the hospital. This is work that's going to be ongoing for some time to try and improve how we deliver better, safer care for all our patients on the urgent care or non-elective pathway. The second thing I want to talk to you about is our planning and preparations for winter. As those of you who were with us last winter know, it's particularly testing time of year in terms of a likely increase in patients who are becoming unwell and who are admitted and come to our hospital for emergency treatment. And we're working very closely and very well with, again, all our partners outside the hospital about actually how we can improve the resilience and the capacity and the ability of everyone from GPs to out-of-hours services to community providers to the ambulance service to us inside the acute trust to respond to those surges, if you like, in emergency demand. And as part of that, all our leadership teams will be talking in the next few weeks how we can ensure we have safe and effective staffing, particularly over the Christmas New Year period, and how we can ensure that all our patients get reviewed every day through that period by a senior clinical decision maker to make sure they get the most appropriate care. And we're also reviewing again with our external partners about how we create additional capacity in this health and social care system to respond to those periods of increased demand. And I suppose my ask is at specialty and at clinical level, you help work with us about how we can make sure those plans are as robust and as sufficient as possible.
Hi, I'm Simon Marshall, Director of Finance and Information for the Trust, and today at Team Brief I've been talking about our financial position, which at the end of August was a small surplus, just £200,000. Nevertheless, that puts us in a good position to meet the challenges ahead. Some of the challenges we're talking around were around our capacity within the Trust, our staffing levels, and how we meet the challenges over the winter period. Basically, all we're asking for at the moment is for everyone to be vigilant in terms of the finances and to concentrate on doing everything they can to maintain flow across the organisation.
Today at Team Brief, I spoke about the staffing challenges. I described in some detail the staffing challenges that we have as an organisation, what are some of the things we're doing to address it, and also what we're required to do by our regulators in terms of controlling the amount of agency spend that we have. These challenges are not just unique to Ashford and St Peter's, but we are doing a lot to address them. First and foremost, we're making sure we offer the right level of training and development so that people want to stay at Ashford and St Peter's once they get here. Secondly, we have regular recruitment drives where every other month we advertise and recruit on an open day basis for staff nurse positions, and that alternates with a recruitment day for healthcare assistant staff. Our most recent initiative, which is quite an exciting one, is that we're offering administrative staff the opportunity to train as healthcare assistants here at Ashford and St Peter's. And just last Saturday, I met 3 of those individuals. One of them was someone who was hoping to be a doctor one day, and that experience will be invaluable to their career.
Hi, I'm Mark Hinchcliffe. I'm the Programme Office Manager, and today we've been talking to Team Brief about quality improvement. We want everybody to be doing quality improvement as part of their day job, and we want to harness people's natural curiosity and creativity to identify areas for improvement, and then we can work with them to make some changes. And we think quality improvement is not just a solution to improving patient safety and reducing errors and reducing harm, but if we get everybody to do quality improvement as part of their day job, we think we can increase efficiency, increase productivity, and reduce costs for the organisation as well. As part of the conversation we had today, we shared a short video that was made by the Institute for Healthcare Improvement. It's a really short and clear video that describes about the benefits of doing quality improvement, and it's something that we'd like to encourage you to share with your teams. We're really encouraged by people's feedback, and we'd like to have more of these conversations. So we'd like to encourage as many people as possible to get in contact with us, and we'd be happy to come and talk to your teams and talk to your staff about how we can do more quality improvement in the organisation.